Welcome to the Evolution Lab. I'm Matt Roberts, and my mission here is to guide and inspire you to optimize your health, performance, and longevity so that you can live your longest, strongest life as the fittest, healthiest, and most vital version of yourself. My guest today is Nicola Marsh. Nicola is a registered dietitian and sports nutritionist with a wealth of experience from years working in the NHS and in private practice as well. For the last 3 years, she's been the head of nutritional services at Evolution, providing our clients with a range of dietary and nutritional support. Outside of her professional career, Nicola is an accomplished athlete herself, having competed at touch rugby at international level, winning 3 European gold and a World Cup silver medal. In this episode, we discuss the importance of qualifications and experience in dietetics, highlighting the difference between registered dietitians and nutritionists. We talk about kidney disease management, the complexities of metabolic syndrome, the need for individualized approaches to nutrition, and the challenges of high-protein diets, fasting, and juicing. We also cover the impact of medications like Ozempic and Wegovy, the health implications of the ketogenic diet, and much, much more. This is a great discussion and one I'm sure you'll take immense value from. So here is my conversation with Nicola Marsh. Nicola, hi.
Hello.
Now, Nicola, you, in case people watching this don't know, you are our dietitian at Matt Roberts at Evolution.
I am.
Working with all of our team, both our team, our employee team, our large team, and also our clients, most importantly, as well, of course. Looking at a whole range of things in and around food, their general health and well-being. And whilst I know your background, tell everyone else about your background, what got you interested in diet work in the first place. And let's talk as well about the fact that you are a registered dietitian rather than being a nutritionist.
Okay, Good question. The registered dietitian versus nutritionist question is a question that comes up all of the time. So I'll do my best to answer that as I tell you a little bit about my background. So I've been a registered dietitian for nearly 13 years now. I graduated from a university in London back in 2012 and have been practicing within the field of dietetics in a variety of different areas since then. Why I went into dietetics is quite difficult to answer. I'm not 100% sure what drew me to it at the time, but I knew that I was looking for a sort of medical field. I knew I wanted to work in a field to do with healthcare. I knew I wanted to work with people and in a kind of helping capacity. When I was at school, I was always fascinated in sports, played a lot of sports, and food was very much part of that experience as well. And I once was sat in the common room. I was at boarding school at the time, and a friend of mine asked me, what would you like to do when you leave school? That kind of horrible question. And you go to your careers advisor and you sit there and they ask you, and I have no idea what I want to do. And
neither they, by the way, no idea.
No. And I was stuck between the idea of pursuing arts and pursuing sciences. And my friend sat me down and said, let's talk more about that. And it was actually her who planted the seed of becoming a dietitian based on all the different bits and pieces I said I enjoyed. I then decided to actually pursue art first out of curiosity. I went to art college for a year, quickly discovered that art was not the career for me. And so that was what kind of sealed the deal.
How bad was it?
It was an experience. I did an art foundation course, which is something that you need to do before you can pursue like a fine art degree at university. And I learnt very quickly that my mind was far more science orientated. So it was a useful experience, that is for sure. And so then I went to university. I did a very traditional route to become a dietitian. I did a 4-year BSc undergraduate in nutrition and dietetics. And this type of degree really gears you up to be working in a clinical setting, in an NHS setting. And when I left university, I went and became an honorary dietitian in a large teaching hospital. I was so eager to work that I worked for free for a few months until my professional registration came through. So when you become a registered dietitian, you have to be registered with something called the HCPC, which is the Health and Care Professions Council. And that is essentially our regulatory body. And they lay out a code of conduct, ethics, and proficiency for any allied healthcare professionals. So physiotherapists would be the same, dietitians, speech and language therapists. There's a whole group of allied healthcare professionals. And I guess that's a good point to explain the difference between a registered dietitian and a nutritionist. Yeah. A registered dietitian is the only nutrition professional that is regulated by law. It's a protected term, and that is because we report to that regulatory body, the HCPC. Whereas the term nutritionist, unfortunately, is not a protected term. So there are nutritionists who have done the requisite qualification and training and are registered as nutritionists with the AFN, the Association for Nutrition. But unfortunately, there are also nutritionists who practice nutrition who have not been through that same level of training. And so it's really hard for the general public to decipher which nutrition professional is offering credible advice.
So a nutritionist could, I'm not saying that they all do by a long way, but they could have done no qualifications whatsoever and call themselves a nutritionist, and no one's going to pick them up on that ever.
It's absolutely possible. And unfortunately, that is what makes the world of nutrition a really complicated place. A sort of simple guideline we can offer is that if you're looking for nutrition advice for a medical problem or a clinical problem, then you need a registered dietitian. That's a relatively straightforward piece of guidance. Accessing a registered dietitian is harder, but that's the type of nutrition professional you'll need. Figuring out whether the nutritionist has the required qualification experience is a little bit harder. So checking their credentials, checking that they have done a qualification that's registered or accredited by the AFM, the Association for Nutrition, will give you that reassurance that you're working with the right professional.
Because within this, the reason why it's important, of course, is that it's possible for, as I say, anybody to say, I'm a nutritionist, or it's part of what I do is nutrition. In fact, in my own sphere as a trainer in that whole world, the amount of trainers who give out dietary advice alongside their training, of course, is probably 99% of them. Because that's what they do. That's part of the remit. Are you going to give me advice about what I do for my food? Sure, I am. I've done it myself. Of course, I have. Naturally, I'm not going to say it's all been great. It's certainly been a mixture. I'm hoping it is, but it's all about really understanding who to listen to, and not just what they might know, but what they might not know about the individual. So the diagnostic end of things is, by and large, probably missing. And nutritionists don't necessarily understand the individual they're looking at. So making a broad statement over this diet is fine for you because I think it's great, I've read stuff about it, is a long way away from what's right for the individual necessarily.
Yeah, absolutely. So I think it's really important to say that whilst qualification is key in terms of knowing if somebody has the kind of requisite credentials, it's also about experience and about gaining clinical experience. So it's all very well that someone might be a registered dietitian or they might be a nutrition professional, but have they gained the relevant experience in practice? Most registered dietitians, but not all, will end up in the NHS for a period of time. And that is because our undergraduate degree is very much geared up to working in clinical practice. I worked in the NHS for 6, nearly 7 years across a variety of areas. And the area where I ended up working primarily was in renal dietetics, so working with individuals who have chronic kidney disease. And this area of dietetics is really fascinating because as a dietitian, you become an integral member of the multidisciplinary team. Unfortunately, the nature of chronic kidney disease means that once you are a renal patient, you're always a renal patient because chronic kidney disease is progressive. The reason I'm sharing that with you is because part of the clinical experience of working in renal dietetics means you're having to understand the individual as a whole throughout the whole process and their journey through kidney care. And that includes understanding diagnostics like blood testing, biochemistry, but also how to complete a really comprehensive nutritional assessment. The British Dietetic Association, which is the Association for Dietitians and our trade union, lays out guidelines in terms of how to undertake a clinical nutritional assessment, so that you can understand an individual completely. And that is often the part that's missing when information or advice is offered from nutrition professionals who haven't had that level of experience or qualification. And part of that nutrition care process includes understanding things like biochemistry, but also clinical diagnostics as well. So you can make a really rigorous assessment of who is this individual, what are their nutritional requirements, and how can we best meet those nutritional needs.
We'll touch more upon some of the things that are happening in terms of lifestyle change, what's going on. Did you find your time in the NHS, how long was that for, by the way?
About 6 to 7 years.
Did you find people during that time, was there any, in a too short a period of time, any increase in events happening, in kidneys being a problem? Because we know that clearly things we're doing to ourselves through lifestyle choices, through things that we have that we are abusing, whether it's be alcohol, bad food, processed foods and so on, lack of exercise, it's going to be having an impact. We know on the liver for sure, we know on the heart for sure, kidneys therefore for sure as well. Was that noticeable at that point?
Yeah, absolutely. So the primary cause of chronic kidney disease and progression was poorly controlled type 2 diabetes, and often part of that picture was also poorly controlled blood pressure, which can cause a lot of damage to the kidneys. And if the kidneys aren't working as they should, then unfortunately there can be lots of problems that occur with that. And as a dietitian, my role was in helping those individuals to either delay the progression of the chronic kidney disease and also to help manage any symptoms or negative side effects of having poorly functioning kidneys.
With blood pressure in mind within that context, what's the level that you'd say is the warning light level? Because actually this has changed more recently. You always thought 120, 125, over 70, 75, some of those back to normal level. You were fine up to about, remember a really well-known doctor who writes for a well-known newspaper in the UK saying that up at 150 over 95 to 100, you're still fine and okay. More recently, that's been brought way down to being, I think, around 130. But from a perspective of kidney issues and problems and failure, what's the kind of the boundaries there that you'd have to cross from a BP point of view?
I think it would be difficult for me to lay out set parameters in terms of what the systolic and diastolic blood pressure would be in terms of where kidney damage occurs and doesn't occur, because it is something that would happen over a long period of time, and it's also multifactorial and individualized to that person. Something that we often talk about at Evolution is this idea of metabolic syndrome, and blood pressure is one factor that contributes to that collection of factors that can lead to metabolic syndrome.
Let's break down what that is initially. So yes, kidneys are part of that process.
Yeah.
The liver is part of that. Liver issues part of that process. The gut is part of that process. What else is in there that's causing the problems, and which things are coming through as being most problematic you're seeing right now with our client base and the wider world?
In terms of metabolic syndrome specifically. So when we think about the kind of broad definition of metabolic syndrome, there are a number of factors that we're looking at. One of them is blood pressure, as we've already said. The other is to do with glucose control, so insulin resistance and how well the body is tolerating glucose. The other factor is to do with central adiposity, so that's the build-up of adipose tissue around the middle area. That's very close to some of our important organs like the pancreas and the liver, and so the infiltration of that adipose tissue into, say, the pancreas can lead to beta cell dysfunction, which is the cell in the pancreas that produces insulin. So it's those three factors that can contribute to metabolic syndrome. It's also about understanding other lifestyle factors like physical activity levels, which is obviously something we do a lot and talk about a lot at Evolution. And it's also to do with things like smoking and alcohol consumption as well. And it's the collection of those factors that can increase the risk of someone developing metabolic syndrome, which over time, if unaddressed, increases the risk of cardiovascular disease, type 2 diabetes development. And that's where we see the real concerns in terms of poor health later on in life.
We're seeing gains in those numbers now, aren't we, as well? I mean, actually, not just from our own client base coming in. When someone comes to us, we blood test them all, of course. So we get the data from day one. We do now a liver screen as well, which is fascinating as well. Looking at the fatty deposits, looking at that stiffness and that scarring. On a recent podcast, I had Dr. Gareth with me talking through the entire process and what they do. But more importantly, what's causing that to be a problem in the first place. And I was staggered actually by the fact that when I asked him about what the impact on the liver most commonly found was as a liver surgeon, he said that against what you'd assume as being alcohol is processed foods. So that's rising up the stakes of what's causing problems in the liver, and for sure with the pancreas, and for sure with the gut, and for sure with the heart, and so on. It's all clearly linked in together. It's getting someone, of course, when they're coming in and they're exhibiting metabolic syndrome, how to let them know that, how to process the idea that's what it is, when they understand what that is. They know they're unwell, but then how to make sure that they have the willingness to then be tested as they need to. People are afraid of having liver testing done, for example.
Course.
People are afraid of having blood testing done in case you find a thing that's wrong.
Yes.
But we obviously encourage and we advise and support through that, and make sure the information is given in a way which is not softened off, but softened off slightly perhaps, with a real game plan thereafter. How much are you seeing people resistant to changes?
It's a really good question. Being proactive about your health is a really wonderful thing, in the sense that it allows you to gather more information about your current circumstances, and with that information we can then take appropriate action, whatever it might be. But it's also a really anxiety-inducing and really worrisome time for people, especially if it's the very first time that they've considered that there might be something going on for them. Something like metabolic syndrome and those factors like insulin resistance, elevated blood pressure, can be going on in the background for many, many years before you're even symptomatic or before you're even aware that something's going on. So having a blood test, having a liver scan, whatever it might be, brings reality into the situation, and that can be a really scary thing for somebody. So I think it's really important that we hold space for that and give someone the time that they require in order to process it. Readiness for change is a concept that I explore in my consultations with our clients a lot, because it's often something that's overlooked. There's a lot of information out there in terms of this is what needs to be done, or this is the action that could be taken, but how ready someone is to implement those changes into their life is not necessarily a straightforward thing. Because we only have a finite amount of resource available to us, whether it's time, energy, effort, and we all have heaps of different priorities. And where our health fits on that list of priorities is fluctuating at any given point in time. So my role in that consultation process is to sit with someone and figure out, okay, where are you at on this process of readiness for change, and what needs to happen to move you towards taking action? So whilst part of my job is to provide information, actually, it's a really small part of my job, because most people have a sense of what needs to happen, but most of my role is actually about helping someone to achieve that. How do you do it? What action needs to be taken, and what does that look like?
I think going back to my first question about the differential between being a dietitian, registered, and nutritionist, is that with that exact point in mind, when clients come into us, I know they've been to other places and they are given, this is your diet plan. You are going to eat these things. You're going to exercise in this way. That's it. This is breakfast. This is lunch. This is dinner. These are the snacks. These are the protein shakes you're taking. And you have to do this because that's what we say you have to do. So readiness for change is you're changing, because if you're not changing, you're not on our side. Whereas in reality, life doesn't work like that. The mind doesn't work like that. People don't respond in that way. They do for a bit. But in reality, they're not really changing. They're just adhering. And there's no actual change going on.
No, exactly. And the most powerful change occurs when somebody is driving that themselves, when somebody accepts that there is something going on for them that they want to do differently, and that motivation is intrinsic. It comes from them. No one in reality really likes being told what to do. Most people will resist that change. And as a healthcare professional, it's really tempting to try and tell somebody what to do because we want to help. But actually, it's not about doing that. It's about, walking alongside them and through that journey and helping to facilitate change with them, rather than telling them what to do. And people will make progress at their own pace. That's okay. There is no right or wrong way to go about improving your health, and everyone's journey of change looks really different. And I think that is part of what really motivates me to be a registered dietitian and to support people, because it's so varied. Everybody's journey is entirely different. And And as a dietitian, we work a lot in trying to understand people, what it means to be a human being, understanding how to communicate with people so that our conversations are helpful, that they're non-judgmental, that they come from a place of compassion. And so it is very rewarding when you do work with somebody and they are able to facilitate change, because ultimately we are helping people to make a positive change in their life, whether it is an improvement in their health, whether it is symptom reduction, whether it is achieving a sporting goal, better meeting their training demands. It's a really rewarding process.
I think there's probably a few key goals people are trying to achieve right now. Amongst them, we over a number of years have been pivoting much more towards being we're a health span company. That's what we do, and health span is all about being able to live your life to the highest energetic, active capability until you're 85, 90 years old.
Sounds very alluring.
And it might well be that you die 2 years later after that, but that's fine. You lived a very full life and active life. We're not looking at longevity necessarily. We're looking at health span and fulfillment. That's obviously a good goal. And that's quite, in some ways, that's an easier pitch in terms of the dietary changes, because that's going to be a case of we aren't going to do a quick change here and now. It's adaptation, it's change over time, it's making sure we understand and are knowledgeable about food and all around it and how to interact with it.
Yeah.
The other demand area is always, I've got a month. I need to lose a stone. What do I do? Nicola, give me the diet. What do I follow? And that's really tricky, isn't it? Because that's something which it's beyond the normal expectation. And yet everyone's read so much about it and be fed so much about the idea about being able to do that on a transformation program that it becomes, well, you can't do it, then those guys can do it. And reality is it's a short-term fix hit with real negative consequences, potentially.
Yeah, absolutely. There's a lot in what you said there that makes me think more and more about the role of a dietitian in helping an individual understand their food relationship. And I know that we've talked a little bit about metabolic syndrome and cardiovascular health, and another area that I work in is to do with sports and exercise, nutrition, but actually underpinning both of those is helping an individual to understand their food relationship. We've all got one. We've all got a relationship with food, how we think and feel about food, how we interact with it. And that can determine our eating behaviours. And it's those eating behaviours that will then impact on our ability to achieve those goals or our health or whatever it might be. And when we think about food relationships, I don't know if it's interesting for me to talk about the kind of spectrum of what I typically work with in terms of eating behaviours.
Yeah, absolutely.
So when we think about eating behaviours and food relationships, I like to explain them on a broad spectrum, where one end of the spectrum might be what we call normalised, what is even normal eating, but normalised eating, optimised eating behaviours. And there are lots of characteristics of somebody who has an optimal relationship with food or normalised eating behaviours. And this is these kind of characteristics or factors of what we're striving for, regardless of what the goal might be. And that's where there is variety. That is where there is a regular meal pattern. People are nourishing their body and their mind regularly. That is where all food groups are represented, whether they're represented in all meals or they're represented across the day. So it's highly nourishing. It's nutritionally complete. It's also really flexible. Someone who has an optimal relationship with food has flexibility. There might be times when somebody overeats just because food tastes good. That is a feature of having an optimal relationship with food. But that overeating then doesn't lead to discomfort or compensatory behaviours. So there are lots of features of an optimal, normal relationship with food. And then if we kind of swing the pendulum all the way to the other end of the spectrum, we've got what we would call eating disorders, which are clinical diagnosable eating disorders that meet a set of clear diagnostic criteria. And you may be familiar with eating disorder terms like anorexia nervosa, for example. And these eating behaviours are highly problematic. And it's when an individual is really suffering with a complicated mental health condition that is resulting in this eating disorder scenario. And that is where a multidisciplinary team is required in order to provide the best care for that individual, but also to achieve a diagnosis to figure out what the nature of that eating disorder is. But then we've got this whole spectrum in the middle, from optimal eating behavior to eating disorder. There's kind of a grey area. And we often put the umbrella term of disordered eating there, and people can kind of oscillate up and down that spectrum. And when we say disordered eating, people who are in that sort of disordered eating space don't necessarily meet diagnostic criteria for an eating disorder, but their eating behaviours are still problematic in some way. They're still causing some discomfort or emotional distress in some way, and are having a negative impact on their health, whether it's physically or emotionally. And it's those individuals that I work with day to day. And the real challenge with this space is that a lot of those behaviours have become normalised through social media, through mainstream media. A lot of those behaviours have even been glorified and might be behaviours that people strive for in the belief that they're going to be improving their health, whereas in reality it's actually costing them something. So the reason I think it's really important to lay out that spectrum of eating behaviour is that, yes, as a dietitian, we're there to provide information and to educate, but actually it's got to be without compromising someone's relationship with food and with themselves.
Yeah, I mean, they're all great points. I think that it's such a vital aspect is having them try to understand the individual and trying to get into the head of how they work, how they think, how they respond to being in and around food. That relationship is such an important aspect. And that's a slow process. That takes time.
Yes.
And it takes patience on both sides.
Yes.
The individual comes to you, says they need to lose weight within a month.
Yes.
And trying to deal with that, there is such conflict. It's hard to then see someone getting actual change happen.
Yes.
Combine that with metabolic syndrome at the same time, and failing organs, liver not functioning well, issues with utilizing or resisting glucose. Suddenly you have this whole storm going on where you've got someone who's not patient, isn't prepared to actually do the full work, can't make a change because their body's not responding very well, and wants to try and lose that stone for the wedding in wherever. So it's a really hard thing to get through and get right. Endangered further by social media generally now, with people who are talking about different diet programs and plans and approaches, and I did this and I did whatever it might be, looking great because they're doing their butt in the air bikini shot, and this is me because it works for me, it works for you, which is complete crap. We know that.
Right.
So it's about really going down to if we had to look at some of the eating fads and ideas and approaches, and there are so many out there.
There are.
Which of these things are based in any form of semblance of sensibility, science, fact?
Yeah.
Which ones are complete and utter bunkum, which is really ridiculous? I mean, the ones that spring to mind really are, I guess, the last few years in particular, high protein eating.
Okay.
So people loading in vast quantities, going for guys having 180 grams of protein per day, eschewing all other good forms of eating good fats, taking away most carbohydrates. It's a full-on pretty much caveman diet. That's been really big the last few years for guys trying to bulk up, beef up. What's really going on in that scenario? What's happening to their body? Is there anything within that's a good thing? Are there upsides to this? How bad are the downsides to that?
So talking about protein specifically, I guess from a mainstream media perspective, protein's got a bit of a health halo, we often call it, unlike things like carbohydrate, which mainstream media will lead you to believe is sort of Satan's spawn. But protein does have this health halo, which essentially does come with its problems as well. And that is... mainstream media is so polarizing and dichotomous in its perspective and things that it can leave people feeling very confused, very conflicted was the word that you used earlier. And that is absolutely the experience of many of the people that I work with. They're so confused and conflicted. When it comes to protein specifically, it is an important nutrient. It is an important macronutrient. What we know is that the general guidelines around protein consumption in the UK are really conservative. The recommended daily allowance is about 0.8 grams per kilo per day, which is very conservative. And we now know through better research that actually protein requirements are probably likely higher than that for most people, especially active individuals and especially aging. aging individuals. We are all aging. So as we age, unfortunately, a process called anabolic resistance occurs, which means that our muscles are normally in balance between muscle protein synthesis and muscle protein degradation. And muscle protein synthesis is the process of the buildup of muscle, and that's stimulated by two primary mechanisms. One is exercise, and the other is nutrition, is eating. But unfortunately, as we age, that anabolic resistance means that the muscle protein synthesis response is less compared to when we were younger. So therefore, our protein requirement is higher in order to elicit the same response in the muscle. Now, it's not dramatically higher, as mainstream media might lead you to believe. The ballpark figure will vary from person to person. So it depends on activity levels, it depends on age, depends on the goal, and it depends on other clinical features as well. So it'd be difficult for me to say this is what is required.
Because the high protein diet thing, I mean, I hear people talking about this where they're having 1.8 to 2 grams per kilo per day.
Yeah.
So a guy weighing 100 kilos,
Yes.
200 grams of protein per day. And I just put that in context.
It's impractical.
Yeah, I mean, how many breasts of chicken is that? It's about it's
8.
8 to 10 breasts of chicken per day to get through, which, you know, it's a lot for sure, that question. So it's there's that. And then alongside that, there's obviously the issues with trying to digest that much protein.
Yeah, so there are scenarios when having that amount of protein, 1.8 to 2 grams, sometimes higher, may be indicated for somebody, whether they are a highly exercising individual, maybe they have a specific goal in mind to do with body composition change, or maybe there is a rehabilitation and injury rehabilitation process going on. Higher protein requirements may be indicated. There are clinical scenarios where higher protein requirements may be indicated as well. But there's always the practical challenge of translating that into real life food. What does that look like? We also have to think about if someone is consuming that amount of protein, it might mean that that's at a cost of another nutrient. So it's compromising someone's dietary intake in other ways. It might displace other nutrients, and therefore the overall nutritional intake is no longer balanced. So excess protein consumption, there is some really interesting research that looked at what amount of protein in grams per kilogram we can consume safely. And I think the research got up to 3 grams per kilogram per day.
Wow.
Had no negative effect in healthy individuals. And it's really important to say that in healthy individuals.
There's people in their 20s, 30s, what was their age group? Was it across both sexes?
Yeah, it was looking across the spectrum, but it doesn't take into account individuals that have underlying health problems. So when I worked in chronic kidney disease, in my NHS career, protein was a nutrient that we did have to modify depending on what stage somebody was at in terms of their kidney function. If somebody has normal kidney function, then really there isn't too much worry about consuming excess protein other than all for those reasons I talked about before. But as chronic kidney disease takes place and declines, because the breakdown products of protein are filtered by the kidneys to remove them from the blood, when the kidneys aren't working properly, those levels can build up in the blood and cause people to be very poorly. And so as chronic kidney disease progresses, protein requirements reduce. But if someone is then on dialysis, which is an intervention that does the job of the kidneys, because there's increased protein loss through dialysis, protein requirements increase. So I guess all of this to say is that everyone's protein requirements are entirely individual, depending on so many different factors, that it's really important that an individual assessment is made to determine what someone's needs really are.
But in the main, if there's someone who's listening to this and they're thinking, well, I go to the gym 3 days a week and try to put a little bit of muscle mass on, I've been told that having 2.5 grams of protein per kilo of body weight is going to be good for me. And they start doing that at the expense of maybe, because you can't eat that much food. I mean, it's a case that you can eat that protein, but as you say, it's expensive having then carbohydrates and some good fats elsewhere. then that's all they're going for. If this is a guy going pumping some weights here and there, they're going to be constipated, most likely.
If it's displacing carbohydrate, if it's displacing fiber, there is an increased risk of constipation with that. Yeah, absolutely. And if it means that there isn't room for things like fruits and vegetables because they're too full from protein,
gradual malnutrition going on.
Yeah, then micronutrient deficiencies may also be part of the picture as well. So it always comes back to balanced nutrition, which I know isn't very cool or very exciting, but it is fundamentally a foundation of good human health.
So to move on from the kind of stuffing your face with protein 18 times a day to almost the converse of that for fasting. So fasting or various versions of fasting.
Yes.
Now, I've gone through various phases of looking at this stuff and listening to this stuff, and I've tried these things to see just as a guinea pig what they look like and feel like, whether that's 16/8, whether that's 24 hours, whether that's 48 hours. And I mean, it's pretty horrendous, to be honest with you. So going for a long fast, and I've got people I know who've done 5-day fasts.
Gosh.
Of just purely, pretty much water only over the 5 days, and convinced that they will get some form of cell regeneration. They'll get the dumping of senescent cells. They feel better. They feel good. I just don't believe a word of it personally. I think it's complete rubbish. But I do think there's something personally, this might go against the grain for you, in a 16/8 approach to eating. I think this kind of intermittent fasting, from the point of view of having maybe an anti-inflammatory effect and a gut rest could be interesting. So we should dive into looking at that. It's all about frequency of that as well. And I'd caveat that too with if you're exercising really hard and trying to achieve certain goals, it's quite hard to fast. You're missing out on what you need when you need it.
Yes. So fasting is a really broad term, and there are different modalities of fasting that someone might undertake. Whether it's sort of time-restricted feeding, where somebody might only be consuming food during a restricted window, so a little bit like the 16/8 protocol you mentioned earlier. Whereas there can be forms of intermittent fasting where somebody may eat nothing or very little on, say, 2 days of the week, and then they might eat their normal diet on the other days of the week. And then there are much longer fasts that also exist, 24-hour fasts, even longer than that. And it's a complex area. Yes, there is really interesting research out there that does indicate there may be some benefits metabolically to fasting.
Coming from what mechanic? What's causing that? What's the main reason why that improves potentially?
Potentially. So there's a concept called the metabolic switch that can occur during fasting, where the body switches from using carbohydrate as its primary source of fuel to using fat as its source of fuel. And it's through that mechanism and the changes that occur at the cellular level within our mitochondria that seem to perhaps present benefits when we're thinking about metabolic health. And there are lots of studies out there that look at this, but primarily these studies have been in animal models, mainly in mice. And that in itself presents challenges in terms of extrapolating that research into human beings. Does the same cellular level change occur in human beings that we see in animal models? But I guess the angle that I come at it from a dietitian who works in practice, seeing people day to day, is more the practical challenge that fasting presents. Practical in terms of how it allows someone to engage in the world in the way that they really want to, but also in terms of the risks it presents to someone's nutritional status. For example, in a time-restricted feeding window, is there enough opportunity for somebody to eat all the nutrients that they need? Same with intermittent fasting. If there are 2 days of the week where diet is highly restricted, what happens to someone's eating behaviors on the other days of the week? Fasting is a form of restriction, and we know that restriction comes with many risks, whatever forms that takes. So lots of people I work with will want to adopt some sort of fasting approach, and that's okay, and we can work with that. But it does require careful planning to ensure that when they are eating, it is nutritionally complete, and also that those fasts in themselves, those periods of restriction, are not leading to problematic eating behaviours when they are eating.
Because in theory, you're right, because someone within a sort of 16/8 approach, let's say, they're eating twice a day, effectively. And the chances are within that have breakfast as one of those meals.
Yes.
And then it's going to be an early dinner for the next one.
Yes.
And then the breakfast might be some yogurt and some fruit. And then the dinner might be, a larger thing. But you've in effect be one meal a day, in effect.
So you've reduced your opportunity to be eating in a nourishing way. And so for some people, if often an intermittent fasting approach or a time-restricted feeding approach is adopted if someone's wanting to lower their calorie consumption. The research shows that whatever method you take, whether it is a fasting approach or a non-fasting approach for calorie reduction, the outcomes in terms of weight loss are the same. But what people tend to experience is that sticking to a lower calorie consumption is easier when your window for eating is reduced. So it can help with that adherence side of things. It isn't that fasting confers better health outcomes, it just helps someone stick to the plan, essentially.
Less time to eat.
Yeah, absolutely. But when we go back to what I was saying earlier in terms of food relationship and the experience that I have in that regard, my experience is that any fasting approach or restrictive approach, if it's in the context of somebody who has a complex food relationship, is ultimately more problematic than it is helpful. So if you're going to...
Because you're trying to enforce a rule on somebody.
Yeah, so just any form of disordered eating, a feature of that is often around rules and rigidity, and also around restriction. And so fasting is just another form of that. And as I was saying earlier, sometimes social media or mainstream media can glorify some of these practices, and fasting can be an example of that. We have to think about how helpful is that for the individual, physically and emotionally. So if someone comes to me and would like to adopt an intermittent fasting approach or a time-restricted feeding approach, we'll talk about it and we'll explore the pros and cons, and figure out whether it's in their best interests or not. And if someone would still like to go ahead of it, that's also okay. We work with that. And that's what I mean with readiness for change. As a clinician and as a practitioner, we've got to meet someone where they are and work with those set of circumstances. Fasting might be a part of that picture, whether it's ideal or not for that person, but I'm still going to come along with them whilst they do that.
And if they do, you're working then on the balancing of what those meals have to look like and be in terms of their quantity and their quality to make sure there's spread the loading and so on as well, of course, naturally within that. If someone comes in, they've got a specific issue like a gut-related, like a SIBO type of thing, IBS. Is there a potential upside to looking at intermittent fasting to allow time for the gut to rest? I hear different reports on this.
Again, it's on an individual basis. IBS, irritable bowel syndrome, is something that affects lots of people. I think it's about 5% of the population will experience IBS. And IBS is actually a disorder of the gut-brain axis. And getting an accurate diagnosis for IBS is really, really important because if overlooked, actually some symptoms that you might perceive to be irritable bowel syndrome could be symptoms of something more sinister. So it's really, really important that adequate assessment takes place to determine if it is IBS. From my experience, fasting doesn't generally tend to be that helpful for managing irritable bowel syndrome. Irritable bowel syndrome can present with a constipation predominance, or it can present with a diarrhea predominance, or a mix of the two. And eating regularly is a really important first-line treatment for IBS because it can help stimulate the movement of food, the passage of food through our gut. There's a process called peristalsis, which helps to move food through our gastrointestinal tract. And there are also various reflexes that occur along the bowel, and eating food helps to stimulate that movement through the bowel. If somebody is constipated and has constipation, and we start to implement further restrictions on food, and that may lead to a further reduction in, say, fiber consumption, then that may only exacerbate constipation. So this comes back to taking an individual assessment with every person, and figuring out what the best action plan is according to their needs. Fasting is rarely the solution in most cases.
Which leads to the next of the interesting diets, which is my favourite of these things actually, because it's so bizarre, is juicing diets.
Oh.
Yeah, always fun. So I'm going to guess that the answer to this in terms of are there positives is a straight no.
I rarely give a straight no, as you've probably seen. The answer.
However, in this case.
So there are very, very few scenarios where juicing is of benefit, and I can't really think of any. It's a really difficult one because I work with lots of people who have found from their personal experience that a period of juicing is beneficial to them in terms of their sense of well-being.
But is that a psychological thing as much as physical, really, in reality?
Probably, but if that's their experience, that's their experience. And I don't think we can invalidate that. I think the challenge with juicing is that mainstream media will lead us to believe that juicing will help to detoxify the body. That's the kind of message that's often portrayed. Sure. But juicing will do no such thing. You know, our liver, our kidneys, our lungs, they are detoxifying the body all of the time. And if they're not, then we'd be very poorly and likely heading to hospital. So juicing cannot detox. But if psychologically it offers somebody an opportunity to reset and reconsider their health, you know, that could be a positive practice. I would never, or very rarely, actually, I would never recommend juicing. I would never recommend juicing.
Can't see that happening at all.
No. You know, juices are devoid of nutrition in terms of protein, in terms of low glycemic index carbohydrate, in terms of unsaturated fats. So there isn't a scenario where consuming only juice is of benefit.
And finally, I think might be your favourites, keto eating.
Keto, by favourite, do you mean?
As the one you sort of kick the table when someone says I'm doing a keto diet.
No, it's really tricky. So there is some really interesting historical science around the ketogenic diet, which you may be aware of, that it was originally developed in the management of epilepsy. So it is a diet that is used clinically.
Talk to what it is actually first. People listening actually might not have heard of the ketogenic. Talk about the foods you avoid first of all, the foods that you add.
So the ketogenic diet is essentially a very low carbohydrate diet. Fundamentally, there is a lack of consensus around what we mean by very low carbohydrate diet, but in practice that typically translates to less than 50 grams of carbohydrates per day. So that's sort of less.
The context is like a slice of pizza.
Yes, so one slice of bread is about 15 to 20 grams of carbohydrate, one slice of bread. So you're looking at 2 to 3 slices of bread in a day, and that's the only carbohydrate. So that means there's no or very little bread, pasta, rice, noodles, potato, cassava, yam, none of that. There is also very little fruit, and starchy vegetables as well. There's also no sugar, anything like that, honey, maple syrup, all the rest of it. And so as a consequence, the diet becomes high in protein, but it is very high in fat. Most calories will come from fat. This is where the concerns come in from a nutrition and dietetic perspective. If you eliminate carbohydrate almost entirely, then you're removing dietary fiber. And if you're then replacing those calories with animal products and animal fats, you are dramatically increasing the saturated fat content. And so I have worked with numerous individuals who have come to see me having followed a ketogenic diet where they have become constipated, and their blood biochemistry shows that their cholesterol, their total cholesterol and their LDL cholesterol has gone up. So the ketogenic diet can be really alluring, and it can feel very appealing because it often comes with promises of rapid weight loss, for example. And we live in a world where weight loss is glorified. And so it's understandable that many people may seek out the ketogenic diet for that purpose. But my concern as a dietitian is that the risks to our health, physically and psychologically, are far greater than any potential benefit.
It's being bigged up as being a longevity diet in a massive way right now. So keto eating is being really pushed out there, and keto products and all the things that go with it.
Yes.
And I'm just not convinced at all it's the way to go for all the reasons you've highlighted. We are effectively gradually malnourishing the body again. You're missing out on what you need to try and ensure you've got a good internal organ function. You've got energy to be able to do the exercises to do. People say, no, I feel energized on doing it. Well, I think you're not. You actually can do a certain amount of things, generally low intensity. If you try to add intensity into your program, play some tennis, lift some weights, it falls apart pretty quickly. It gives you bad halitosis and BO and some anal leakage. That. So not over appealing overall.
No, and it's a good point you make there in terms of exercise, because carbohydrate is the body's primary source of fuel for exercise, especially at any high intensity. And if we think about the work we do at the gym, asking our clients to resistance train and lift heavy weights, we're asking them to recruit large muscle groups, and that's really energy costly. That requires carbohydrate as a source of fuel. Many of our clientele, and perhaps it's not exclusive to our clientele, but across the board, would be training fasted or maybe following a low carbohydrate diet. And that comes with its risks in terms of impact on hormonal health, but also on our ability to train effectively and to get those adaptations to exercise that we're looking for in terms of strength and fitness will be compromised when we train fasted and when we have inadequate carbohydrate in our diet.
So I think recently Nikki K touched upon in a conversation with me as well about carbohydrates and balancing the hormones out. She hates the word balancing hormones out in your body to make sure you got what you need to ensure the body's functioning very well. And without carbohydrates being present, it just becomes very difficult, mainly because there isn't the ability to do anything. You can't actually do the additional workload, you can't up the intensity, and therefore your body starts to suffer and go backwards.
Yeah, so she might have talked about the female and male reproductive hormonal axis, which is the hypothalamic pituitary gonadal axis, being testes in men and ovaries in women. And that HPG axis is tightly coupled to something called carbohydrate availability. So how much carbohydrate is available to the body to support exercise, but also to support activities of daily life and to support all physiological mechanisms. And unfortunately, over the last decade or so, probably longer, there has been such a shift towards low carbohydrate eating that what Nikki and I are seeing in clinic is there's an increased risk and increased presence of low energy availability, relative energy deficiency in sport. And these conditions are not just affecting active individuals or athletes, they affect your everyday gym goer, they affect your weekend warrior, and it's something that's frequently overlooked. There is so much information in mainstream media around maintaining a low body weight, avoiding carbohydrate, restricting food groups, that Nikki and I are seeing more and more individuals who are suffering as a consequence of that.
When we get clients coming into us, the first thing we do is obviously a blood test. So within that, then there are things that we find clearly we know are wrong, or we know for sure that vitamin D levels in all blood tests now 80+% that we're seeing in facilities are super low. What are you seeing in things like HbA1c? So explain what it is for a start, and then what we're seeing in the numbers as well.
So when we think about metabolic health, cardiometabolic health, understanding blood biochemistry can be useful to give a more complete picture of somebody's metabolic health. And HbA1c is one of these markers that we can look at to inform where someone's at in terms of their metabolic health. HbA1c is shorthand for glycolated hemoglobin. Hemoglobin being the protein that's carried inside our red blood cells that transports oxygen around the body. Glycolated meaning how much glucose is essentially stuck to the hemoglobin. And that gives us an indication of whole body glucose tolerance, how much sugar, glucose, has been circulating in the blood for the preceding 3 months. So we know that our red blood cells have an average lifespan of about 3 months. And so HbA1c gives us an indication of the average amount of glucose that's been in the blood, for the preceding 3 months. And it is a marker that is used to assess for prediabetes and type 2 diabetes. And it is also a marker that's used within type 1 diabetes to understand how well controlled blood sugar levels might be. And we're really lucky at Evolution that we can understand that information for a client. And what we're noticing is that I think it's around 50% of our clients who do have their bloods tested with us show that their HbA1c is at the top end of the normal range or in the pre-diabetes range. And we've even had a number of individuals who have gone on to have a diagnosis of type 2 diabetes following a blood test with us.
Now, as a client, someone who they are generally busy individuals working very hard.
Yes.
They are probably asset rich and time poor. So there's lots of stresses on their system mentally. There's they'd probably say themselves in most cases, need to try and unwind at the end of the day. It could be a glass of something really great. maybe more than 1 glass, and the whole kind of a life setup there, which is it's intensive, very intensive, and therefore there's an enjoyment of things they have as well, so they can access and reach for all things, alongside the need to try and de-escalate any sort of stress in their system, which comes at the cost of the body responding then in such a way where it can create this position where it becomes a bit pre-diabetic potentially. Is there an argument, and this is kind of a current topic right now, is an argument for that person to look at using things like Ozempic and Wegovy to try and contain that blood sugar profile, or is that going to be sort of a storm to add to the mix?
So medications like, semaglutide is the medicine that is sold as Wegovy or Ozempic, those are other names of the same medication, has been used in the management of blood glucose control in type 2 diabetes for a little while. And it's only more recently that it has become available to individuals who do not have diabetes, as a method of helping to promote weight loss or to manage blood glucose levels, which are actually fine. And it's really complex. It's not a straightforward option.
Because this is a diabetes drug, isn't it?
Yes.
At the heart of the whole thing, as you said, it's been used for a long time doing that. Much, much, much longer than being a lifestyle drug.
Absolutely.
Which is now what it is. It's used off-label. So on-label usage is used for diabetes. Off-label is used for losing weight. Now, does it work for losing weight? Yeah, it does. We see it all the time without question. Does it have an impact which is negative? Yes, we know that it does on certain levels. Does it have an impact negatively that's going to be long-lasting? A bit too soon to say. But it looks as though there could be some issues there within bowel, within that kind of slowing down the digestive processes. It might be there's change maybe in the way in which the body can utilize sugars. We're not quite sure yet fully on that. Pancreatitis has been caused from this, we know, from long usage beyond a couple of years. So some nasty things going on in there. This person with higher HbA1c, it could be good to look at it and think, well, it could be a good thing to try and treat that. It's almost on a medical need on label.
Yes.
But you could be pushing to a position where you're making the body reliant on that thing and making it get worse.
So it's important to understand the root cause, the pathophysiology of somebody's elevated HbA1c to then determine the best course of action. Because there are different causes. And we'd also need to understand what lifestyle factors may be contributing to that elevated HbA1c, because there are lots of modifiable factors in our life to try and reduce HbA1c or improve glycemic control before looking at medication as an option. But there are scenarios when medication may be indicated, and that decision needs to be made in a medical environment in collaboration with that individual to determine what is best for them. Unfortunately, these medications, like you say, are being used off-label, and they're being used without the relevant and the required level of supervision, whether it's dietetic supervision or medical supervision. And what you and I are seeing amongst our clientele is that actually health is suffering. So a drug that might be taken to have a positive outcome, the intention from that individual might be to have a positive outcome, is unfortunately resulting in negative health, poorer health outcomes.
What are we seeing as signs of that? Obviously, symptoms of that are quite obvious right now, aren't they?
Yeah, so the purpose of but the mechanism that the drug works by is not only to improve glucose tolerance. It does that because it is an incretin mimetic. It means it mimics insulin, essentially. It helps to stimulate the production of insulin to improve glycemic control, but it also acts as an appetite suppressant. And so what happens is individuals' appetites are greatly reduced, their consumption of food is greatly reduced, which is the primary mechanism by which weight loss occurs. But because appetite can be so greatly reduced, we are noticing that it's compromising someone's ability to eat a nourishing and nutritionally complete diet. And if people are not given the support that they need and they deserve when undertaking a medical intervention like that, They might not be having advice in terms of micronutrient supplementation, multivitamin use, for example. They might not have guidance on how to optimize their fiber consumption, for example. And so we are typically seeing micronutrient deficiencies. We're also seeing that leading to people getting poorly more often, picking up bugs, coughs and colds. We're also seeing constipation more often because of the compromise in fiber consumption and the slowing down of the bowel. We're also seeing lethargy and fatigue, very low energy levels, which means somebody might not be able to undertake exercise or activity at the intensity that they were before.
Well, a recent study showed actually that people who were taking these products, these semaglutides, it was in either Wisconsin or one of the US universities, to show that those people taking it had a significantly impaired desire to exercise, mainly because they're just so knackered, constantly exhausted. So therefore, you don't want to get out of your chair and do something, and the problem gets worse. You're slowing down a bit, losing muscle mass. Adding to that with a mix of then this medication, which it makes it even faster. And you're in this kind of vicious spiral going downwards.
Yeah, and it's indiscriminate weight loss. So, you know, it's fat and muscle when the weight loss occurs. You know, we can't target just losing fat. We are noticing that muscle mass loss is also happening as well. And so again, you know, even though someone might set out with a really positive intention for themselves to take this medication, the poor health outcomes are now becoming clearer in terms of loss of muscle mass as well, which will compromise someone's strength and fitness. And that alongside a nutritionally incomplete diet might compromise bone health, increase risk of falls. You know, the story, the picture doesn't look very optimistic.
Well, we've had a lot of people coming through the clubs who don't need to be taking it, who are taking it.
Yeah.
And they've asked, it's a good idea. We tend to say, well, no. But if you're insistent on taking this thing, well, it's your choice. But it has to be on the guideline that there has to be a certain approach to weight training that we undertake. It has to be intensive.
Yeah.
Of course, they can't take lots of work because the energy runs out too quickly.
Right.
They can't do high intensity interval work, training work, cardio work, because there's, again, lack of energy after time. They can do the longer endurance work. That's actually sort of okay. But whilst they're, as a little guinea pig for us, whilst they're taking that thing at various doses and doing the work that needs to be done and adhering to eating enough protein that they can stomach at that time, in that moment, they lose weight. And in that moment, they lose body fat. But deviate out of any part of that one thing, reduce the intensity of the resistance work, take away the cardiovascular work, and it falls apart. They gain the weight back on again. They up the dose further, try and make sure they lose more weight, and they're stuck in this spiral. So it's fine if you were set in a guinea pig setup. It was in a clinical setting where he said, take the thing and do this and this and this and this. Does it work? Definitely. I know it does. Does it keep on working? We don't know yet. We're not quite sure. Is it something which you have to stay on that same program exactly? Yes, you do. Outside that, then you start to gain the weight back and you panic. So whilst I personally think it's a really nice idea that it does work, and in certain people, diabetics, it definitely works. Beyond that, as a solution longer term, this is not the solution longer term, which is why more recently the NHS planned by Wes Streeting to give this to everybody who needs to lose weight to get back to work again. I think it's unbelievably flawed. And I hope it never gets passed as an approach, because it will fail. People will start to lose weight, they will feel good for a bit, and then stay on it, get worse symptoms. Not be able to go to work, like going to the gym. They can't feel like doing that. Same for going to work as well. Not do the intended outcome. And then come off it, gain the weight back, lose all confidence, and then back to square one and worse.
Yeah, I think it's a really personal issue for people in terms of weight. And I think initiatives like that, unfortunately, fuel a lot of weight stigma. And there is often a lot of stigmatizing language that goes on around managing body weight. And what we know from growing research is that stigmatizing language around bodies actually leads to poorer health outcomes.
Sure.
And unfortunately, rolling out medications like Ozempic and Wegovy comes from the same narrative of weight and health being synonymous. And we know that that's not the case. And unfortunately, in the pursuit of weight loss, where many people might take that route with the belief it'll improve their health, we're actually seeing poorer health.
Yeah.
So changing that narrative and trying to uncouple weight from health is, I think, of fundamental importance for us to help to cultivate, greater success and positive change in individuals' lives.
Nicola, we're out of time. Thanks for everything. People can find you, of course, with us.
Yes, you
can. So they come in, and we also do a blood test when someone first comes in. You then analyze all of that, and you work with individuals super closely for us, and work with the training team, and with our broader team as well. You work with Nikki Kay, who advises on our hormone side, with Sophie Medlin, who does our gut side when need be as well. So you're our conduit point with all these things. So if you're coming to see us, we'll see you.
Yes.
You analyze all their data, and then we set their program in place, and you work with our training team hand in hand to then look at their training plans. So it's a really good hand-holding approach, isn't it? So it's a really exciting way to work, and you're phenomenally good at doing it as well, which is great.
Thank you very much. Well, thank you for the questions, and thank you for listening to me. It is really fun to be working as part of the team at Evolution, and as a dietitian, it's quite a unique position. And I get to work with a team of personal trainers day to day, and all these individuals, all our trainers, are working with clients, multiple times a week to try and cultivate greater strength, fitness, from a real positive place. So I feel really lucky that I get to help influence that from a nutrition perspective. Being a dietitian in the fitness industry is a relatively unique role. So thank you very much for having me and allowing me to do that.
It's a joy, as always. Nicola, thank you. It's great.
Thank you, Matt.
Thank you for joining us today in the Evolution Lab. I hope you're able to take some great information and inspiration from our discussion. And while we love creating motivational and moving content for you, what I'd love for you to do now is take from today's episode what felt most relevant to you and apply it. And if you need help with that, or simply want to let me know what you thought of the show, please do reach out. You can connect with me and my team on social media simply by searching for my name or the handles at Matt Roberts Evolution or at Matt Roberts PT. Alternatively, head to my website, mattroberts.co.uk, where you can find out about the work we're doing at Evolution and get even more info about the show. If you found this episode valuable, I'd really appreciate it if you can take a moment to subscribe and let us know what you think about the show. Your support means we can reach even more people, change more lives, and reach even higher highs. Thank you so much again for taking the time to tune in today. Until next time, I'm Matt Roberts, and this has been the Evolution Lab.